morning. Welcome to the 11th Annual Nonprofit Institute Conference, but the first ever entirely virtual conference. My name is Kyle Keebaugh, and I am the Assistant Director of Strategic Initiatives at the College of Southern Maryland. Part of this position at the college includes oversight of the CSM Nonprofit Institute, which is your host of the conference today. I'm excited to be your Master of Ceremonies for this year's event. They say that being on camera adds 10 inches of hair. Wait, maybe it was that the camera adds 10 pounds. I was born and raised in Southern Maryland. I'm now raising my own family here as well. I'm a proud member of this community who come to visit, enjoy the waterfront recreational activities, culinary diversity, and rich history. However, not many are aware of what takes place behind the scenes to make Southern Maryland so great. Nonprofit organizations are vital for the community since they also provide a means for drawing public attention to societal issues. Nonprofit organizations strengthen communities by providing the educational, health, and social services that citizens need and which the government cannot fully provide. As many of you know, the Nonprofit Institute works with nonprofit organizations throughout Southern Maryland, helping to enhance their effectiveness and achieve success in fulfilling their missions. We are the central resource for nonprofits throughout the entire region, providing many classes, workshops, networking opportunities, and consultation, all designed to meet an organization's needs and interests. We aim to bring people together to build a more unbiased, inclusive, and sustainable society. As of this morning, we have assembled an online network of more than 300 individuals to take part in this milestone of virtual professional development. Joining us for this morning's kickoff, we have two members of CSM leadership. Our first guest is Dr. Maureen Murphy, President of the College of Southern Maryland. Dr. Murphy is our fifth president to preside over CSM. Dr. Murphy's career in public higher education spans more than 30 years, including over a decade as community college president. Since her arrival, CSM has twice been recognized as among the top 150 community colleges in the country by the Aspen Institute in its Aspen Prize for Community College Excellence program. More recently, CSM joined the Achieving the Dream Network in 2019, supporting the college's commitment to equity in educational opportunities and outcomes. Prior to CSM, Dr. Murphy served as the president of Brookdale Community College, a multi-campus community college in New Jersey. Among her initiatives were developing early college high school programs, launching a collegiate promise program for free tuition for all qualified graduates, and spearheading a minority male conference to support the academic achievement of minority male students. Before her appointment at Brookdale in 2012, she served as the president of San Jacinto College in South Houston, Texas, and as vice president of both Rappahannock Community College and Wytheville Community College in Virginia. Murphy began her career teaching English at St. Louis Community College, Merrimack, where she later served as dean. Please join us in a computer-generated welcome for Dr. Maureen Murphy.
Thank you so much, Kyle, and I'm delighted to be here. Can you believe it? This is our 11th Nonprofit Institute Conference. Since I've been here, I've been able to step into every single one, and I have to tell you, I'm always just heartened by the work that our nonprofit community does. We know that you do God's work. You really do. We live in a region where the need is great. The wealth gap is extraordinary. And now we're in a global pandemic. And I'm just so proud of the work our nonprofit institute has been able to do since we all went remote almost a year ago. It's been a tumultuous time. The Nonprofit Institute responded quickly. I know this personally. I know that Kara and Robin were involved in almost weekly calls with hundreds of participants. Now things have kind of gotten a little more steady, I hope. We hope. I also served with Kara on the Charles County COVID Recovery Task Force, and I saw all that she did to connect you with the resources that were possible for you to keep going and fulfilling your mission. CSM has never been prouder of the Nonprofit Institute than it is today. Honestly and truly, I'm so glad that we are able to continue to have this conference. It's important It brings together people and resources and ideas, and it builds your capacity to keep serving our community. And our community really needs you right now. God bless you for what you're doing. Nobody came here to hear me welcome you. You all came here to learn and to connect. And so now I'm going to turn things back over to Mr. Kiba, our Master of Ceremonies. So welcome.
Thank you, Dr. Murphy, for joining us and welcoming all these dedicated community leaders. Next month, we'll complete a full calendar year since CSM first experienced a disruption in operations due to COVID-19. The pandemic has significantly altered nearly every aspect of college life, from admissions and enrollment to athletics. These concerns extend to the financial future of higher education institutions in a time of considerable financial instability, both in the form of unexpected costs and potential reductions in revenue. Likewise, nearly every aspect of operations of nonprofits have also been shaken. Organizations have had to find new ways to provide their services while staying as close as they can to their stakeholders. Adapting to change during COVID-19 is necessary, especially when we hear talk of the new normal, implying that the situation has irreversibly changed our relationship with the world. Here today to provide you with some guidance for embracing your changes is Dr. Sybol Anderson, the Executive Director of Equity and Inclusive Diversity at CSM. Dr. Anderson is a social and political philosopher whose commitment to building inclusive communities has been a central part of her career for more than 15 years. Anderson earned her PhD in philosophy at Johns Hopkins University, becoming the 19th African-American woman to earn a doctorate in philosophy in the United States. As an associate professor of philosophy at St. Mary's College of Maryland, she founded and directed the D'Souza Brent Scholars Program, an academic and leadership program for first-generation and low-income students and other students from groups underrepresented in higher education. Anderson has also served as the inaugural Chief Diversity Officer at Loyola University, New Orleans, as well as Senior Program Manager and Senior Consultant for the GE NMF Primary Care Leadership Program of National Medical Fellowships Incorporated. At NMF, she provided oversight for 2 National Service Learning and Research Scholarship programs for medical, law, and graduate health professions students. These were designed to increase diversity in the health professions and improve health outcomes for the medically underserved. Anderson began her higher education career as a continuing education professional at CSM when it was known as Charles County Community College. She also served as interim executive director of Southern Maryland Job Training Partnership Association. When she entered graduate school, she worked part-time as a training coordinator for the Southern Maryland Tri-Community Action Committee, and later as the executive director of East John Youth Center. Please join us in a computer-generated welcome for Dr. Sybol Anderson.
Good morning, everyone. I am so very happy to be with you at this virtual conference. I just want to, before I say anything else, want to really congratulate the Nonprofit Institute in mounting this wonderful program. And thank you so much for inviting me to be part of it. I am so excited for today. I was saying earlier that I'm kind of vibrating. But anyway, I want to get started. For immediate release, February 29th, 2020. The Centers for Disease Control and Prevention and public health officials in the state of Washington have reported 3 hospitalized patients who have tested presumptive positive for the virus that causes COVID-19, including 1 patient who died. 2 of the patients are from a long-term care facility where 1 is a healthcare worker. Additional residents and staff of the long-term care facility who have not yet been tested for COVID-19 are reportedly either ill with respiratory symptoms or hospitalized with pneumonia of unknown cause. The patient who died, a male in his 50s, was being treated at the same hospital. He was not a resident of the long-term care facility. The CDC erroneously identified the patient as female in a briefing earlier today with the president and vice president. While there is an ongoing investigation, the source of these infections is currently unknown. Circumstances suggest person-to-person spread in the community, including in the long-term care facility. This is the first reported death in the United States from COVID-19, as well as the first reported case in a healthcare worker and the first possible outbreak in a long-term care facility. These reports from Washington follow others of community spread in Oregon and 2 places in California earlier this week. While there's still much to learn about the unfolding situations in California, Oregon, and Washington, preliminary information raises the level of concern about the immediate threat for COVID-19 for certain communities in the United States. Most people in the United States will have little immediate risk of exposure to the virus, although some people will be at increased risk depending on their exposures. 2.5 weeks later, the entire country was on lockdown. How little we understood a year ago today that our whole world was going to turn upside down. Our theme today, 1 year later, is nonprofit resilience, adapting to change. Have we needed to be resilient? So ordinarily, before giving a talk, I'd be calling forth my own resilience to push through my nervousness. Like I said, I'm shaking. Ordinarily, I'd be shaking in my boots. Now today, I'm shaking with excitement. And the reason I'm shaking with excitement is because to address today's theme of resilience, there really is no better way than just to hold up a giant mirror and talk about you. You are the picture of resilience. I'm so grateful for a conversation I had with Kara Fogarty and Michelle Sullivan that brought so clearly to light for me just how extraordinary you all have been in this year. They talked about the things that Dr. Murphy just alluded to. The fact that immediately after the lockdown, you got together, 100 of you, on a call right there at the beginning of the lockdown in late March. You forged new connections and collaborations that you hadn't forged before. There were 43 requests to start new nonprofits between June and December. New friendships, and let us not forget the virtual Christmas party. You're amazing, and as Kara said, and I quote, "I have never seen the nonprofit community come together like this." You all banded so tightly together to serve our community together. And you did that notwithstanding all you endured personally and with your own families. I know it's been a lot. Thank you. You are the picture of resilience. But what is it that has made you so resilient? I'm a philosopher. And so, I started out really sort of contemplating what is the meaning of resilience? How do I talk about the meaning of resilience? Just talk about you. But I want to dig in a little bit more into what makes people resilient, into the essence of resilience. Why? Because maybe by doing so, I can give you an even better picture of who you are. Not that you don't already know who you are, but we're human, and sometimes we don't see all that we bring to the table. And I think that people who serve others and are so focused on others day in and day out as you are, ought to be reminded of what you bring to the table. So that maybe someday in the uncertain future, when you're tested again, and your spirit kind of feels like it's on the floor, you'll be able to look in the mirror and remember you are the picture of resilience. But the essence of resilience is faith. The essence of resilience is faith. Faith in whom or in what? Well, in a number of things that I think are really worth noticing. For many of you, it's faith in your family, friends, and colleagues, your new nonprofit BFFs. They keep you going. Good old tangible human support, a listening ear, a shoulder to slobber on, a hand. Being given a hand when you need help helps keep you going. Don't ever hesitate to ask. Knowing that there are people you can count on for that helps keep you going. I love so much the way you all came together to help each other through this crisis. 100 people on the first call, the end of March. For some of you, it's faith in those you serve that keeps you going. Your clients, students, the families you serve, the communities you serve. I know that in this work, those who serve are typically viewed as the benefactors, and those who are served are typically seen as the beneficiaries. We're the active ones, they're the passive ones. Of course, you and I have had far too many experiences of the genius, resourcefulness, commitment, and yes, resilience of those we serve to miss what they bring to the table. Faith in their capacity to change their lives, that keeps us going too. And sure, there are setbacks and challenges, moments when they don't believe in themselves or when they set themselves back, just like we do. But the fact that they keep showing up, that is everything. And if they don't show up today, maybe they will next week or next month or next year. Maybe then they'll be ready. In the meanwhile, we take a break, but we don't lose faith in them. Faith in them keeps us going. And actually, when I first said faith, the first thing to pop into your mind might have been religious faith. Faith in God or the universe or something larger than ourselves. Of course, not everyone ascribes to faith of that sort, but for a lot of you, that faith and trust in something larger than you that governs or guides or just has a better handle on the order of things, something greater that you experience as bearing you through changes and other forces beyond your control. Yes, forces even like a boulder labeled COVID that falls out of nowhere and lands right in front of you. So massive, there doesn't appear to be a way around it or over it. Faith in something greater than that. Whether for you it's the greater order of things in nature or the source of the order of things if you conceive of one. I know that that enables some of you to keep going, believing that although you may not now see the way around the boulder, there is a way and you will discover it in time. And so we come to you. I hope you have faith in yourself, belief in your own genius, creativity, resourcefulness, commitment, your tenacity, and yes, your resilience. Do you see what you bring to the table? I hope you do, because believe me, others around you do. Certainly through your work and your consistent showing up and your partnership with others, your collaboration, you've demonstrated many times over that you are someone to believe in. And don't worry if you have moments of doubt, doubting others, doubting your clients, doubting the order of things, or as we most commonly do, doubting yourself. It sounds paradoxical, but I really do believe that faith is so much more powerful than doubt that I think doubt can't ever really undermine faith. Here's why I believe that. Kimberly Fosu, a Ghanaian-American writer, tells a story of trying to get to Ghana as her father was dying last March. Flights got shut down, and she was here while her father was being buried over there. As soon as international flights resumed, she got organized because she had to get home to her family. Among the many details she had to master, visas, baggage weight limits, she also had to ensure negative COVID results for herself and her daughter from a test done no more than 72 hours before their flight. Now, it would take 3 to 5 days for the results to come in, so there was absolutely no guarantee that she'd have the results in time. Their flight was booked for Sunday evening, 8 p.m. Kimberly and her daughter took their COVID tests early Friday morning, the earliest they could take them and still be within that 72-hour window. She followed up with the pharmacy on Saturday, the very next day. You do know this is the weekend, they basically said. You'll have the results by Wednesday. Kimberly did all she could do. She prayed. She packed. She monitored her email. Of course, she had every reason to worry, even to doubt under those circumstances. But at 2 p.m. on Sunday, her negative COVID results arrived. Kimberly says she apologized to God for doubting. I wrote to her and asked, did you doubt? In the face of these odds, you packed your bags. You checked your email regularly, like the results were coming. Okay, so you worried, of course, but I still see a lot of active faith there. You showed up for transatlantic travel. I think that when we keep showing up in the face of doubt, we are demonstrating the active faith we have in whatever it is we have faith in each other, in the order of things, in ourselves. That faith is powerful. That faith is the essence of resilience. And so as we go forth into the great still unknown, still facing so much uncertainty, still slowed down by the boulder labeled COVID, know this: whatever happens, you've got this. You are resilient. The essence of your resilience is your faith. Keep the faith. And somewhere somebody should be queuing up Don't Stop Believing by Journey. Thank you all very much and have a wonderful, fabulous conference. I'm really excited to be working with you. I'll see you around. Thanks.
Thank you, Dr. Anderson, for your inspirational message. You've served to energize this virtual crowd, and we are all looking forward to what the day will offer. Before we separate for our first 5 sessions, I'd like to take a moment to recognize and thank a few people. Kara Fogarty is one of our coordinators and is in her 5th year at the Nonprofit Institute at CSM. Kara works with the Charles County nonprofits as their professional resource in the local landscape. Kara has also served as the wizard behind the curtain in our Oz world of Hoova. Michelle Sullivan is our program specialist, also in her 5th year at the Nonprofit Institute. Michelle serves as a specialized expert for both Charles and St. Mary's nonprofits. Robin Finicum is our other coordinator and just completed her 1st year at the Nonprofit Institute. Robin works with the St. Mary's County nonprofits as their professional resource in the local landscape. Additionally, I would like to bring attention to individuals and areas from CSM. Ellen Flower Fields, Associate Vice President of Continuing Education and Workforce Development. Joyce Thompson, Director of Operations for Continuing Education and Workforce Development. The CSM Information Technology Department, the CSM Marketing Department, the Planning, Institutional Effectiveness and Research Department at CSM, all of our CSM colleagues who volunteered to help moderate today's conference sessions. I would also like to thank Steve Jobs and Bill Gates for creating the technology that connects you to us today. Of course, I can't leave out all the speakers and panelists who are here today. Many of them have actually had to find an outfit that wasn't pajamas, so please thank them for that. They are here today to share their knowledge, insight, and resources. They don't receive any compensation for their time today, so we cannot thank them enough. Before you settle onto your couch, stability ball, or standing desks, I wanted to bring up a few housekeeping items. Bathrooms are down the hall from your bedroom, living room, or home office. Coffee and snacks can be found in your kitchen. This conference, like many of our classes and workshops, is designed for you, usually with your input. Within Hoova is a survey for every session, as well as the keynote speaker. Please take a few moments to rate your experiences of the sessions you attend. These can be found within the surveys tab on either the desktop or mobile versions. We would also like your feedback regarding your overall conference experience. This survey can also be found within the survey tab, but will also be provided with a follow-up email by CSM staff. In addition to all the sessions today, the Hoova app offers opportunities for networking and conversation. Be sure to visit the community section on either your desktop or mobile version, where you will find virtual meetups, discussions, announcements, and so much more. And you can set up your own meetup, post an article or job opening, post discussion topics to get the conversation going, and so on. Everything will be available on the app for 6 months, including all session recordings. So please just give us some time to upload them over the next few weeks. We've created this virtual event to offer something new for everyone, and we hope you leave here today with a few new ideas, tools, and practices to help you with your approach to leadership, planning, problem solving, fundraising, and communications. Ultimately, we hope your organization is stronger, more effective, and successful in meeting your missions. The first session will begin at 10 a.m. So please go brush your teeth, find a creative Zoom background, and check out the day's agenda on Whova. Thank you and enjoy your day of learning.